these exchanges also are going to do official certification. If someone truly can't afford, really at any cost, it's a possibility, though, even though the law is intended to provide coverage for everyone, no matter how low their income is, there may still be situations where there's just no affordable health care, even at a reduced premium level. And so in that case, the exchanges are supposed to actually grant a form of a certification to those people so that they don't at least have to pay the penalty. So it may be a relatively small group of people whose income is so low that even with the reduced deductibles and copays, and even with the premium tax credit, still can't afford to pay the premium that would be charged for minimum level of insurance coverage, and would therefore normally have to pay the penalty for not having insurance. If they get this certification from the exchange that their income is that low, that they meet, because there's no affordable health plan available to them, that certification is going to be important to them, put it in their pocket or whatever, because refer to it, because that will get them out of paying the penalty then. So anybody else, though, who doesn't get that certification and just chooses not to have health insurance, you would have a penalty to pay come 2014. And I'm sure there will be people of whatever political stripe who maybe just don't like being told, just like some kids don't like to be told by their parents you have to do this, or some employees don't like to be told you have to do that. I'm sure there will be people who will just, as a matter of principle, refuse to get the health insurance, and we're going to be willing, presumably, to pay the penalty, and that's okay. And that's why when people are projecting how this law is supposed to reduce the level of uninsured people, it's not going to reduce it down to zero. There will be some people who won't have insurance coverage, but it's supposed to be a relatively small number, of course. Another important role these exchanges are to play is to determine whether a plan, whether it's a individual health insurance policy or a group plan that would be provided by small employers, meets the minimum requirements under the law to be a so-called qualified health plan. So that's going to be a new term that you'll get used to when those exchanges are up and running, or close to getting up and running, called a qualified health plan. And to satisfy the requirements to be a qualified health plan, the plan would have to provide certain essential health benefits with limited cost sharing, limited out-of-pocket costs passed on to the individual or the employees. So I think there will need to be more regulations in place, because right now there aren't any, of course, as to what exactly those benefits will need to be. But in broad outline, these qualified health plans are intended, I think, to be may grow to be one of the primary form of health plan coverage. Not that a plan will have to satisfy that definition. You'll have many health plans, employer-sponsored plans, that won't be qualified health plans, and there won't be anything necessarily wrong about providing some other kind of health plan coverage, especially if it's even more affordable or more beneficial from a cost perspective or benefit perspective. That's perfectly fine. So there's not a requirement that all plans be qualified health plans. They're just trying to create a category of qualified health plans that satisfy certain minimums and would be available either through your employer or through the exchange itself, as, in terms of a place where an individual could go and get insurance coverage that now is not available. And these exchanges are also, this is not on the slide, but they're going to, apparently, according to a summary I read anyway, and I admit I've read some parts of the bills, but I haven't read all 2,000 some pages.
That's
so
quite an admission, Brian.
Yeah, I admit that.
How dare you?
How dare I? But from one of the summaries I've read, this certification of these these qualified health plans is going to actually categorize them as either bronze, silver, gold, or platinum, these four categories based upon the covered percentage of value of the benefits under the plan. So I'm not sure what factors go into that exactly, but bronze equates to like a 60% covered percentage of the value of the benefits, silver 70%, gold 80%, and platinum 90%. So,
and that's sort of an actuarial determination, isn't it? That your plan covers 60% of what someone might need in a given year for health care. Isn't that sort of what it is?
I think so, but I'm not totally sure as to how, if it's an actuarial determination or otherwise.
Under Medicare Part D, there's already a similar provision on prescription drug. You have to, determine whether your prescription drug plan meets a certain percentage of what a typical American would need for prescription drug. So I think that's the general amount. Scott, do you